The Ministry of Health, known as MOHD or KKM, is a Malaysian government ministry which is in charge with health-related issues that has contributed to the country's development. They are responsible for ensuring the health of the people and provide a good service when dealing with the patients. The service that provided by MOHD is health clinics, hospital, institutional care, community-based healthcare, and many more that are related with health. The current Health of Minister of Malaysia is Dr. Zaliha Mustafa since 3 December 2022 until now. Deputy Member of Parliament, Bukanisman Awang Sauni, a second-term MP from Gabungan Parti Sarawak GPS, as Deputy to Health Minister. This means that the MOH, which gets the second largest budget from the federal government every year and is run by two junior lawmakers in the unity government, even though the country is facing multiple health crises. Zaliha said that she was aware that people were expecting good governance and service from the government, and she pledged that she would do what was right and best for the people. The objective of MOH is to assist an individual in achieving and sustaining as well as maintaining a certain level of health status to further facilitate them in leading a productive lifestyle, economically and socially, with the vision of a nation working together for better health.
Assalamualaikum, my name is AZRUL bin ADIN and I will explain about the function of data collection in hospital. So, to use the data collection from the COVID-19 cases, for primary data collection, it is important to start by identifying the types of data that are desired, the sources and the basic methods. The main purpose of the data collection is to gather information in a measured and systematic manner to ensure accuracy and facilitate data analysis. Since the data collected is meant to provide content for data analysis, the information gathered must be of the highest quality for it to be of value. Regardless of the data collection methods it's selected, it is essential to maintain the data's neutrality, credibility, quality, and authenticity. The subsequent data analysis will provide real insights and practical guidance if the data is genuine and free from errors, discrepancy, or loopholes. Moreover, in order to use the function of sales projection in our organization, we use Excel to collect the data from the COVID-19 cases. So for the problem definition, many organizations managing sizable sums of rebates still rely on manual methods for calculating, collecting, and assigning rebates in spite of the technology at our disposal and the significance of precise and full data. They frequently find themselves searching for inaccuracies, balancing data, and attempting to base crucial choice on a variety of partial or incorrect refund data. So we're moving on to the problem of calculation. So for firstly is lack of security. Comparing a manual calculation to an electronic system like Excel, the manual calculation is less secure. Additionally, since a lot of paperwork and documents are sent by email, where anybody may view them, this method is less secure. For the time-consuming, calculating by manually is a difficult and time-consuming task. The process of transferring data from one format and re-entering it into one or more different systems or spreadsheets takes a lot of time. Automation results in more time spent on tasks that generate profits by cutting down on both the amount of the time and the number of personnel required to execute each task. So, we're moving on to the difficulty in a modification of data. It is significantly more difficult to make adjustments while using paper documents. Manual procedures are unreliable, imprecise, and time-consuming, and as a result, you are unable to determine if you can trust the accuracy of the calculation or whether the data you are viewing is up to date. Performance problems such as spreadsheet that takes longer to load and conduct calculation while becoming apparent as the amount of data increases. So for the last point, which is increases cost. The accompanying costs are one of the manual calculating system's main shortcomings. Additionally, since so many firms use labor-intensive accounting practices, it's very impossible to lower the cost of accounting operation. because they frequently act as the glue connecting accounting operation across a large number of systems. Data sources and entities, physical data extraction, spreadsheets, manual adjustment, and data entry have a significant negative impact on efficiency.
Assalamualaikum and greetings to the Marsus Jabar. So for my part, I will be presenting about the demo for the Excel calculation of data collection. So here, as we can see, when you want to do some data collection in Excel, it is simple and really easy. So first one here, what you're gonna see here, you need the variable first. In this case, we use the Ministry of Health of the counting for COVID-19 cases from 1 until 8 January 2023. So the first one you need is the first variable, which is the state. Here, the state. So you're gonna list the state because we need to measure the COVID-19 cases from 1 January until 8 January in every state. So we're gonna list every state for the first variable here, and then for the rest is the day of the cases recorded from 1 until 8 January, and then you just insert the data from 1st January until 8 January, just like that. And when you want to sum up, you're just gonna click here from 1st January until 8 January, and then you're just gonna click the outer sum and the right above here. Just gonna click, and then once you're done that, you don't need to do the same thing. You just copy the I4, because when you do that, the formula will be copied, and then you're just gonna pass from I5 until I19, and then you got the result for all the listed cases for every state. As simple as that. So when you want to read the cases from graphically or chart, right? You're just gonna click all the variables here, and then you just click insert and then go to the chart, and then you choose the chart that you prefer, that is easy to understand and readable. So from here, and then you got this as the result, and every color from this bar chart will represent every state. So as simple as that. That's all for the demonstration of data collection and chart. Thank you.
For the benefit, there are a few benefits of using Excel. The first one is you can perform calculation. What makes Excel the best spreadsheet application on the planet is its ability to perform calculation. Secondly, you can print report easily. Even if you are a person who likes to save trees, but there could be a point where you need to print report to share with others or present them to someone. Well, Excel allows you to print a lot of customizations where you can change the margin, paper size, and orientation. Thirdly, transform and clean data. If you are one of those people who work with data a lot or know someone who work, there are a lot of situations where you need to deal with messy data which you need to clean before you use it. Fourthly, with the ease of organizing data with Excel accounting, users can easily store data in spreadsheet in a more structured manner or in any way they want their report. There is the added feature of presenting the data and accounting result in the form of pie chart and other graphical representations. It is an easy feature to learn even for a mature accountant. Other than that, more comfortable to compare dataset to get an idea of where you are headed in terms of revenue. It is a practice to analyze year-on-year and month-on-month data. So, comparing financial dataset between two periods to calculate income can be done with the click of a button. You could also compare customer base across geographies in the case of a retail or reseller small business and analyze other factors like age, purchasing preferences, and spending capacities to know how your business is performing through Excel. Finally, macros and formulae. Anyone who has worked on Excel accounting is familiar with the ease-to-use and record calculation related to macros that they can use regularly. You don't need to be a mathematician to work magic on your spreadsheet. Excel does all the work for you. Imagine every month when the company's financial data changes, you will think the whole report will need to be worked on again. With Excel and its macros and formulae, the spreadsheet automatically calculates the data without you having to intervene manually. A hand feature of Excel is What If, which is excellent for forecasting budget based on user preferences.
In conclusion, Microsoft Excel is one of the best programs for managing and analyzing data. It is used all over the world to make visual presentations, automate calculation, and help people in the healthcare to make decisions. Microsoft Excel is a flexible tool that can be used in healthcare to plan and analyze data. Excel can also be used to keep track of the number of infections and to plan surgeries. It can also help health insurance companies figure out which treatment are the best value for money. For example, keeping track of patients, Microsoft Excel can help healthcare facilities keep track of patients' records. Microsoft Excel makes it easy to keep track of treatments and organize files in a way that works well. It lets the medical staff add patients and keep track of how they are doing. So, there is no need to write papers by hand and they can be easily found on the computer.